Welcome back. I wanted to talk to you today about osteopathic manipulative medicine. I spoke to you in our last video about osteopathy as a science and as a practice. Again, osteopathy being the viewpoint that the body heals itself and that the physician, having knowledge of the interrelationship of structure and function, can use his or her hands, to evaluate and treat the whole being. Manipulation is a word that's very misunderstood in medicine today. It's commonly believed that manipulation is forcibly moving the bones to create a popping sound. That is far from the truth. There's actually two basic forms of manipulation. One is called direct, and one is called indirect. Direct manipulation implies that the operator, physician or therapist, is directing the tissues. Most commonly, this is the type of manipulation that creates the crack. This is where position is everything, where alignment is everything, and the operator uses whatever force is necessary to create that alignment. Indirect manipulation is exactly the opposite. The operator, physician or therapist, is now listening to the tissues with their fingers and determining which way the tissues want to go. This very often is exactly the opposite direction of a direct technique. We guide the tissues into positions where it's often referred to as the position of ease or the position of comfort, where the body can regroup, reorganize, and release the stress that had been causing the problem in the first place. Direct manipulation is quick and is often all the body needs to carry forward. But with more complicated conditions like we see here at rehabilitation specialists, direct manipulation may only provide temporary relief. Most of the hands-on body work that is provided here is indirect. With indirect manipulation, we are able to peel away layers of past stresses and traumas that have created tension in the tissues and disturbed the flow and the ability of the body to heal itself. With continued work, we can peel away the layers down to the root cause and eliminate the problem entirely in many cases. At Rehabilitation Specialists of Monroe, all of our therapists are trained in osteopathic principles. They all know how to use their hands to evaluate and treat, looking for asymmetries of position, motion, and tension, applying exact equal opposite pressures, following the changes that the body then initiates to a logical end where tissues release. This is why patients coming to Rehabilitation Specialists of Monroe have sometimes exceptional outcomes.